in the clinical face sheet for our patient, Snow White. And this training video will be useful for clinicians in both the inpatient and outpatient setting. I want to take you up here to the log tab. We're going to click on this and see what we have hidden behind the log tab. Come over here. Typically, we'll open up to the medication log first, and it's going to show you the start and stop times, increase, decrease of all medications. And you can sort this by medications, which is the default way to look at it. So we're looking at all the Abilify orders, or you can sort it by date. Okay. So it's a little bit smaller when you support it by date, but for example, you can look over here and you can see that on 12/17/2015, the Abilify was stopped. And you have the opportunity to come over here and to add a note as to why it was stopped in the comment area under each way that you sort it. So up here it was stop the Abilify. It shows up here, gained 20 pounds in 30 days. By the way, these little white I buttons with a navy blue background, if you click on them, it's going to take you to an online site where you can click information about any of these particular medications and print it out for your patient. These are really nice educational sites, and this is the way to access it from ICANotes. We have lots of other logs in the program. We have a clinical order sheet log, for example. This would be, you probably won't see this in the outpatient setting unless you're working in a large clinic, but in the inpatient setting, you're going to be seeing this a lot. The most recent clinical order sheet is going to show on top to look at previous sets of clinical orders. I'm looking at the full sheet right now, but I could actually come over here and just look at the changes instead. Right now we're at the top again, so we increased the Ambien. The last time we were in here, made a clinical order. And the last time before that, we fooled around with the Prozac. And then this is where we had started the Prozac and Abilify and Cogentin and so on and so forth. So you can keep moving down here until you're all the way at the bottom. You can also scroll up like this and move up to the top. Also, let me just show you here. On this clinical order sheet, you can see that this was picked up by Liz Lobeo, RN, and it has the date and time. All right, let's go back to our clinical order sheet log and scroll down here. We have test requisitions. I'm not going to show you that, but if you enter labs manually into the program, you can see the labs that you thought were important enough to enter into the program in the clinical portion. Not only do these labs show in your documentation area of your clinical note, but they also show here in the lab section. So for example, I had several lithium levels that I was trending over time. When I clicked on the flag here, it immediately illuminated all of the lithium levels, so I could compare the results very easily. Here are the dates associated with that over here. We have a problem and diagnosis log where you see all the diagnoses for your patient. This is pretty straightforward. You can also go to the online site for patient education materials about each of these diagnoses and print them out, give them to your patient. We have a referral log and a request log. Let's see here under the referral log. I actually have two referrals here. I don't know if you can see this clearly. Here's one. Here's the second one. They're actually both to the same clinician, Joel King. But this log can also be printed out if you'd like to. Just a way to keep track of all the logs, the referrals that you've made. Adverse drug reaction log. She only has an adverse drug reaction to sulfa drug, so that's all that's showing. If you added something new, it would show on this log right away. We have a vital signs log. And you can come in here because there's anything under the constitutional exam for you providers out there. The constitutional exam shows under the mental status exam. Anything that you document under that area is logged here over time. So we have this information captured under two separate tabs. So right now we're looking at blood pressures, systolic and diastolic, supine, sitting, and upright. So for example, if I wanted to look at what her sitting pulse rate was, I could click here. Do you want to include all the sitting pulse rates? And I sure do, all of them. And you can see each one's associated with a date Here's a sitting pulse rate of 92 on 12/14/2015. You can see here 12/14/2015, 92. The next one's on 12/21. It looks like it's down here in the upper 70s, lower 70s, excuse me, which it is, sitting pulse rate 72, so on and so forth. You can also turn these into line charts if you'd like to. I happen to prefer, I guess this isn't too bad. I just like to look at the bar side, for example. Let's go over here and look at vital signs also. So if you want to look at respiratory rate, for example, or temperature, you can click here, and I'm going to show all of the temperatures. And I only have three. One was 98.4, the next one was 98.1, and then we had 98.4 again. Okay? You can do the same thing with the patient's weight. Looks like it's been pretty stable. Would you like to include all? Yes, I want to include all the weights. So you can see here, it looks bad. It looks bad, but the program is sort of figuring out the two extremes. So this is 145 pounds up here. This is 140 pounds. So it's not as bad as it looks in terms of the drop or the increase. Let's see what else we have here. We have an Ames log. Basically, you can come over here and you can see your Ames exam if you've done one for the patient. You can actually read it here. You could print it out also if you'd like to. This will also show in your clinical note if you choose to show it there. We have an intake and output that's pretty straightforward, a Menzies log, bowel movement log. This is all inpatient kinds of stuff. Rating scales log. Not all of our rating scales are logged, but some of them are. The Beck A, the Beck D, the MCCA, the CALS, the GAD7, the GDS. Let me see here. We've got the Hamilton A, anxiety, Hamilton D for depression, mini mental status exam, PHQ-9, the CEWA, and the Brayton. So you can actually log these over time. I haven't done a whole lot of rating scales on this patient. As you can see, I did one Beck A and I did one Beck D. If you had an abnormal ASAM scale, you would be able to look on here and see which dimensions were abnormal under your ASAM on this rating scale. This patient hasn't had an abnormal Ames exam, so this is blank for right now. And then I like to set this up here. By default, it will open up to the medication log. Go back to the chart face. And once again, we were just looking at information under this particular lab logs.